Welcome to Doctors on Call. I'm Jenna Miller. If you live with pain, you are not alone. Pain affects more Americans than diabetes, heart disease, and cancer combined. Pain attacks the human body at every vulnerable target: muscles, bones, and joints. Each person and their pain are unique. More than 20% of U.S. adults have chronic pain, and pain sufferer statistics show that women are more likely to experience pain than men. The best way to manage your case could be very different from what works for someone else. Pain management is our topic tonight on Doctors on Call with our guests, Dr. Belle Razafindrabe and Morgan Neely, RN.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Closer Regional Hospital, experts, neighbors, friends.
Dr. Belle Razafindrabe earned his medical degree from Université de Madagascar and completed his residency and training in physical medicine and rehabilitation at the Loma Linda University Medical Center in California after spending a year of internal medicine internship at the same institution. Dr. Belle is certified in physical medicine and rehabilitation by the American Board of Physical Medicine and Rehabilitation. He moved to Great Bend in 2005 and is president of Pain, Spine, and Rehab PA. Also joining us tonight will be Morgan Neely, RN. She is a certified sedation nurse. Thank you so much for both of you for coming and joining us tonight. We're going to go ahead with some of our questions. First of all, let's start with back pain. Tell me, doctor, why back pain is so common?
Very good question. Back pain is so common because the spine is actually the backbone, and especially as we get older, there's a change in the spine structures. And it's about 1 in 4 people have experienced back pain. So 25% of medical visits really attributed to kind of back pain, but not all back pain require treatment. One of the reasons is that as we age, the disc that I mentioned here is the thickness reduced. And when the thickness reduced, then we have narrowing of the opening of the nerves there. Not only that, but the arthritis develops around the joint of the back of the spine and the vertebral body itself, and all of that contributed to narrowing of the central canal and the nerves. And so there are, we mentioned about back pain, but actually there are structures that involved in there, and could be related to the body itself, the disc itself, the joint itself. The nerves come out from the side of the nerve from inside. So it's can be very more specific, but that's one of the main reasons that the back pain is so common because of change during age.
Okay. Let's talk about the latest treatment for spine back pain.
The latest treatment of spine back pain has been changed, so pretty much dramatic for the last 10 years. In the past, we know that multiple people receive open surgeries, which is still ongoing. But due to the fact that people don't have much time to recover, people want to go on a business as soon as possible. The change in back surgery has been dramatically improved into a minimally invasive treatment. And as we know more about spine, there are increasing more research and more study, and also more tools that we have available. Let's, for example, we can talk about spine, this one. Let's say we have someone that is have back pain related to disc, related to that disc, and if you have back pain related to this nerve, the problem is that this disc is pretty thin, so actually for that reason we have pain from the facet getting lower and from this nerve that already creating nerve pain throughout the legs. So for this reason we there are some lots of modalities and tools that will help raise that disc by using small titanium implant like this, used to in between the spinous process. We call interlaminar instrumentation and fusion, and also that one will raise the disc, prevent compression of the nerves, and also help prevent stenosis or tightness of the nerve. There is other aspect of this fusion. This is another tools by different company. This not only improve the space between disc and the bone, but also fuse it using small bone graft. So at this time, it limit anterior flexation, posterior flexation, and lateral bending. In that way, patient with really disc pain can have much improved. We still refer patient for open surgery, but this can be done as outpatient within 1 hour, and patient can go home without general anesthesia, and that recovery is very good. And for the few patients we treated, the result has been great. So those are minimally invasive treatment. Another treatment here is the same, but a little bit different tools. This is posterior instrumentations with fusion, and instead of from the side, it comes from the back this way and implant there. It takes about 1 hour to implant without general anesthesia. So that's one of the latest treatment for spine-related pain, especially those people who are aging, have those change in the spine. So those are things. Let's say we talk about the ladies, most common, or men in 70s, 60s, with a fragile bone osteoporosis. They can have a broken spine or compression fractures. This is one of those treatments that getting balloon inserted into the vertebral body, inflated to create a vacuum or space, and then get cement in there. This can be done in 1 hour, and the pain relief is pretty much instantaneous without general anesthesia. So those are quite new. What I mentioned here is that pain related to spine is currently under control. We can master that pretty much because understanding of the dynamic of the spine and the availability of the tools that we have, treatment can be provided safely and quickly. And so my message to the viewers and the public is, please come and seek treatment, because once pain is developed, the sooner the treatment, the better the outcome. Before 3 months, usually the best, because when it's become chronic, then it's not only a pain, but it affects the psychosocial, behavioral, mood, motivation, and all of that in place.
Absolutely.
Mm-hmm.
Now, Morgan, you've been with Dr. Bell for 7 months. Let's talk about, in the intro we were talking about you were a certified sedation nurse. Let's talk about your role at the clinic.
Okay. So my role is to make sure that patients are as safe as possible during their procedure. So I pre-op them, I give them sedation, make sure their vitals are stable, and give them medication throughout the whole procedure safely, making sure that they're comfortable, and it's called a twilight sedation. So this sedation, they're drowsy enough to be comfortable, and then for doctor to work, he also uses local anesthetics to help as well, to reduce the sedation However, between both of us, we make sure that the patient is comfortable throughout the procedure and they recover really fast because the medications, they have a short lifespan that I'm using.
Sure. And do most patients who come in to get a treatment, do they need anesthesia of some sort?
Of some sort, they may. It depends on what procedure Dr. Bell will be doing. So if he's doing a rather more invasive, so to speak, versus an injection, however, they may need sedation, then that would be up to his discretion if
Absolutely.
they need that.
Okay. Let's talk about the risk of using opioids or narcotics.
We know the trend is now that we try to minimize use of opioids. There are two opinions, two extreme. Those people who say, hey, no opioid at all, those are problems. And then the other extreme and say, we can use a lot of opioid to control pain. There are acute pain. And so those acute pain is really, most of people come to the emergency room for that. Now the plan is to reduce use of opioids, especially back pain, especially kids under 18 years old, high school. The chance is that the sooner they get opioid, the harder to get them off of it. So the reason of this type of procedures is to avoid and minimize the use of opioids. And we have this combination therapy, multimodality therapies, means that combination of medications that we try to have the least side effect but most effective, and the same as medication, we can look at which medication has the most effective least side effect, because those are what we need to check on patients on a regular basis. The use of opioid has been reduced dramatically as we try to address the causes of the problems rather than treating palliatively the pain, and has been reduced. We do provide pain medication for patients with chronic pain that has been needing it, and we do assess them individually as the need basis.
Okay. We want to remind our viewers that we're talking about pain management tonight on Doctors on Call. You can give us a call. Phone lines are open at 800-337-4788. Morgan, if you have a patient that comes in that they maybe are addicted to the opioids or narcotics, do you have to gradually get those out of a person's system? How do you handle that?
Well, it's a process for sure. Are you talking about non-narcotics or
Just right, if somebody is addicted to those medications
Yeah.
that they need to get off of.
Yeah, it's a gradual procedure or process, I should say, of because the adverse reaction of going without automatically is very damaging to the body and mentally as well. So we don't really do the rehab of substance abuse or so to speak. However, we do help with patients reducing their pain medications gradually.
Excellent. Okay, doctor, let's talk about fibromyalgia.
Fibromyalgia is a very generic name, and what we need to know is that is there really fibromyalgia? I have several patients who come to me and say I have fibromyalgia, but actually there are some underlying pain that need to be treated. So number one, assessment is very important. There are people who have some actually real back problems, so real limbs problem that need to be treated and that actually resolve the issue. The true fibromyalgia, when pain is become chronic, more than 3 months, there are change of behavior, change in sleep, change in motivation. There will be change in the patient ability to work. So it affects not only the person, but the family, the environment, and the work. And here we talk about fibromyalgia. It's kind of hypersensitivity. It's a nervous system that is have a low threshold of pain. So anything that is really touching them, that's not painful to normal people, can be feel like wow, hurting me, and those are need to address because they have those people have a lack of sleep. You know, there's no one modality, one treatment that treat it. And people come and say, hey, I need pain medication for this. Actually, opioid or narcotic is not a good treatment for fibromyalgia because it's require restoration of lifestyle. It require improvement of the sleep. It require treatment of the depression. It require having this person to be involved in your community. So that's a process of treatment of called fibromyalgia and require patience. People with fibromyalgia may say, I cannot do this, but actually doing things on a regular basis, that even a small step on a regular basis will help that patient to be eventually be productive.
Okay, we're going to go to the phone lines. We've got Lindsay on the line from Victoria. Hi, Lindsay. Go ahead with your question for our guest tonight about pain management.
Hello. I just wanted to know what you can do for the SI joint to keep it from slipping out.
Well, very important. SI joint, for those who are watching, SI joint means sacroiliac joints. This is the joint that is really below the waist. I have a picture here. This is the pictures of the pelvis. This is the tailbone, and here is the, let me point to you, I'm sorry. Here is the SI joint right there. You can see that on the pictures. She mentioned how to prevent SI joint from slipping out. This joint is the largest joint in the body, and actually statistics show that 10% to 60% of people have pain there. About average 25%. So it's a very common pain. When I began my practicing here in Kansas, I've noticed that there are people that have been having this type of pain for 20 years, and it does not require much to get the treatment done, and it will really remarkably relieve the pain. How to prevent it? Some of the problems is above the spine. You know, anything that above the spine has the back surgery, fusion, all of that. If the spine is fused, then all the motion happening here at the sacroiliac joint and cause this joint to really mobile. There are also people who have ladies who have gave birth and then kind of open up those joints and creating chronic pain from sacroiliac joint. There are weakness of the muscle, of the gluteal muscle here, gluteal muscles that hold the spine and ligament can make this joint really mobile and fragile. Anyway, arthritis itself. But what I would do, his recommendation is to physical therapy, strengthening of the muscle that hold up these joints. Those are important. But sometimes people, oh, I have physical therapy, it does not help. Well, the reason is pain. We need to control the pain. There are now, we have modalities that simple injections help. If it's relieve the pain for enough length, we just stay with that. If the patient come back and say, oh, the pain return, there's a way of doing it. The nerves come in from this spine, the lumbosacral nerve and the branches of the dorsal rami feed this joint from behind. And we can block those nerves as a test. We do a 2 tests. If patient feel, well, great, I feel good, no pain for 3 days. We do the test again in about 2 weeks, consistently relieving the pain. Then we do radio frequency ablation. We take those nerves one at a time and burn them. Or we can use a strip lasering that will bipolar denervation using a needle and the heat from a generator will denervate or relieve or burn or put to sleep the nerves around this joint and actually relieve that. Some patients and say, hey, we've done that and still have pain. And we do have this type of, you can see right there, called allograft. Allograft implant is made of bone, and these can be inserted within 30 minutes. In the past, it has been done a big fusion hardware that's very difficult and painful, and we have problem with change of weather. And now it can be done with allograft bone and can be done within 30 minutes in the clinic. If you have this SA joint that is bothering you and has been treated, come and see us, but there is solution for that.
Okay, tell me, Morgan, has COVID made an impact on chronic pain sufferers, have you found?
I think so. I mean, social distancing alone puts everybody in a funk, so to speak, and people with chronic pain, they have multiple levels of where they're at in life. And so I think COVID alone just really has put a damper on the clinic, because we're back to wearing masks, we're back to checking temperatures, we're doing everything that we can to keep everybody safe. And our patients, I think they sometimes have a hard time with it, but a lot of them are very understanding.
Sure, excellent. What about treatment for arthritis of the joints?
Treatment for arthritis, that's really a good question. As we know that about 1 out of 4 people have arthritis somewhere, and it's more common in the ladies than the men. There is no way we can reverse the arthritis. However, there is a way to slow down the arthritis by a lifestyle, avoiding injury and trauma, and eating plant-based diet. Those are very useful. However, the pain management part is for us is to treat the pain. And let's say lots of people, about 50 out of 1,000 patients may have arthritis of the knees, and eventually may need to have a knee replacement. Some of them are not candidate for knee replacement, or too young for knee replacement, or had knee replacement and still having pain, or contraindicated for general anesthesia and cannot have knee replacement. I've seen quite a bit of that. The good news is there is a treatment available. This is a pictures of knee, and if you can get these pictures, you can see the point there. There are 3 big nerves that feed the knees, and by knowing those 3 big nerves, we can block them. Block those nerves as a trial. We'll let patient go and come back again, another block, 2 block, and 2 successive block will confirm that this pain can be controlled. And then we do the same. We put to sleep those nerves and really relieving that arthritis pain of the knee. The knee is very unique for that purpose. Some of the joints cannot have, we cannot control the pain like that, but at least we have those. When we talk about the wrist, this is a wrist hand we call carpal tunnel. About 3 out of 1,000 people might experience new pain in the wrist, and 50 out of 1,000 people experience prevalence that all the time have pain in the wrist but doesn't do have any problems. The issue that people may not want is that the treatment may take about 6 to 8 weeks if you have surgeries and cannot use the hand, so people reluctant to use that. We do provide ultra minimally invasive treatment for carpal tunnel, which is the median nerve actually runs through the forearm to the palm, and at this ligament, there's a ligament there, it can be compressed and squeezed and causing tinglings and burning and lack of sleep. It prevents someone to sleep, prevent use of the hand. It's hard to drop things. Those are the carpal tunnel, and those can be treated with just a very tiny opening from the hand, and we can use the knife, a tiny knife that get through those ligaments and cut it inside, and you don't have any opening, no sutures outside. And the recovery is the same day. This is pretty new and can be done. We've done a few of those, and the success is great. Patient go home without sutures and able to use the hand really quick.
Okay.
I've had a lot of patients that had the traditional, and the chances of dehiscing, where the wound reopens, are really high because we use our hands, and so it's just a tiny incision, and it's very fast healing. It's
Excellent.
Yeah.
Wonderful.
Yeah.
Thank you so much for your both being here today. That's Morgan Neely and Dr. Bell Razafindrabe. On our next Doctors on Call, we'll be discussing pet health. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
That's it.
Wise.
awesome.
Very good. I was wondering.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Closer Regional Hospital. Experts, neighbors, friends.